Hello and good evening. I want to thank you so much for joining me this evening for our webinar on Amlexanox. I hope that you saw that there was a delay due to some circumstances out of my control after work today, but I sincerely want to apologize for not being here on time today. So here we are. We're here to talk about Amlexanox this evening. My name is Brianna Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy. And we're going to talk about a compound that I just have had such good experience with personally. And I have seen so many of our guests have great experiences with. So we are going to talk about some of the benefits of Amlexanox, the approaches to how we can utilize this in ourselves and our families, and hopefully what you'll find is that you'll have some things that kind of pop out at you of symptoms that you recognize either in yourself or perhaps family members or friends, and it'll hopefully set off some light bulbs for you of where you may be able to find this information to be helpful. So I'm going to go ahead and share my screen with you here. And what we are going to do is we're just going to start off with a little bit more about who Physicians Preference Pharmacy is and how we can support you guys through the use of Amlexanox. So I've titled the slideshow this evening, A Novel Approach in a World Full of Metabolic Disease, because we are beginning to see more and more of this happening in our patients. And so this has really become prevalent. It's something that we have really begun to see in a lot of our patients. So we're going to peel back the layers of what metabolic disease means. But this is a very serious conversation. This is not something that should be taken lightly, because metabolic dysfunction is really the driver for chronic disease as well as for cancer, which we're seeing a lot more of that show up now. So without further ado, let's go ahead and jump into it. Again, at Physicians Preference Pharmacy, we are a non-sterile compounding facility. So we are not offering any injectables, ophthalmics, or IVs or anything like that, simply non-sterile preparation. So usually we're talking about oral capsules, sublingual tablets, we're talking about topical vaginal creams, these types of delivery systems. But tonight we're going to be talking about Amlexanox, which is in the form of an oral capsule. So we specialize in bioidentical hormone replacement therapy, peptide therapy, also immune modulating compounds. And so I want to underscore that, because really the foundation of what Amlexanox provides is bringing the immune system back into balance. And God designed our bodies to be in balance. And so let's remember that, we don't get sick because we have a low level of pharmaceutical drugs in our blood. We get sick because our body is either out of balance, or it's deficient in something, or it's dysfunctioning. In this case, we'll be talking about Amlexanox helps with an overactive immune system for the most part. And that's where we really see it fit in therapy. So each of our preparations available at Physician's Preference are going to be free of any unnecessary dyes, binders, fillers, artificial sweeteners, basically that junk that you just don't need in there. Cheap fillers that don't do you any good, does not do the patient any good. And especially we want to be sure we never have any hormone disruptors present in our compounds, because that's counterintuitive to what we are trying to accomplish with healing. We do ship to 49 states. If you're not located in Texas where we are, we can still ship to you, except for into the state of Alabama directly. But we still do have guests that we work with in Alabama. So if you're there, please do shoot me a note and we can talk more about that. And all prescriptions must be patient specific. So sometimes physicians will offer to pay for their patients' prescriptions, but that's not the way that our 503A pharmacy is set up. And then I kind of alluded to it already, but we take a root cause approach at Physicians Preference Pharmacy. We don't want to over-medicate. That's not the point. We believe that a comprehensive approach looks like lifestyle changes, looks like supplementation, looks like the use of compounded prescriptions, which are either directly replenishing what the person is deficient in or correcting some dysfunction or imbalance that's occurring in the immune system or somewhere in the body. It's also important to know a lot about your compounding pharmacy. You should have transparency when it comes to really any pharmacy you're getting prescriptions from. But here in the last line, I've noted that we are PCAB accredited, and that's a Pharmacy Compounding Accreditation Board. So that's actually an elective accreditation that we get and multiple inspections that we have to go through to be sure that we're not just meeting, but exceeding state and federal regulations. And the reason I think all this is important is because you can choose to get your prescriptions filled anywhere, but you want to have pharmacists and a pharmacy team that's on your side, because a lot of times when you have chronic illness, the last thing you want to deal with is feeling lost in the medical system. And we are here to debunk that. So, do you or someone you know struggle with chronic inflammation, an autoimmune condition, or maybe metabolic dysregulation or other chronic conditions? A lot of times this can seem very confusing because of all of the different options and opinions that there seems to be out there to getting better. A lot of different treatment options. We want to try and simplify it anytime that we can. So have you tried everything without resolve, or maybe, someone in your family has or friends have? Then this information is going to be for you or for them. All right, so we came here to talk about Amlexanox. Let's go ahead and dig in. As a pharmacist, I love to understand about the drug, what it's doing, how it's working, and how can it really apply within our body and work well without having a lot of side effects associated with it, because that's a win-win. So a big part of what I like to focus on is not reinventing the wheel when it comes to treatment. So you may hear about the term repurposed drugs. Amlexanox basically fits into this bucket of repurposed drugs. And what I mean by that is whether or not those drugs are still on the market, what we found, we collectively as people that are doing research in the field of finding out what these medications do, are finding that aside from their original purpose, they actually have new applications which are very effective. So Amlexanox used to be branded as an oral paste that was on the market several years ago. It was called Apthosol, and it was originally used to treat aphthous ulcers. So these little ulcers that happen inside the mouth. The paste would be applied inside the mouth to help to decrease the inflammation and close that ulceration or the wound. It fell out of favor because other products came on the market, but that's primarily in the US. So Amlexanox is still being successfully used in Japan to treat asthma, allergic rhinitis, conjunctivitis, and it shares structural similarity to cromolyn, nasal crom, gastrocrom, and all of those are antihistamines and mast cell stabilizers. And so the reason that that is important is because we want to use something that, even if we're taking it orally and not as an oral paste, so as an oral capsule rather than a paste, we want to be sure that it's functioning in a way that works like an antihistamine, so to bring down inflammation in the body, and also to stabilize mast cells, which are a very important type of white blood cell or immune cell that are present in nearly every system of the body. Now, although this is not a conversation about COVID-19 infection, we've heard a lot more about MCAS, which is mast cell activation syndrome, or basically these immune cells that are being completely overactivated, causing an inappropriate immune response in the human body due to either receiving a vaccination or multiple COVID infections. And of course, everyone handles that differently, as we've seen over the past few years. So we want to be sure that we are giving the mast cells the stabilization that they need so that we're not having this inappropriate allergic response. So Amlexanox, for this reason, is really a novel anti-allergic and anti-inflammatory. It's recently been found to have a much broader list of applications, which I'm going to go through towards the end of this PowerPoint presentation. But just to give you the 30,000-foot view, we're talking about metabolic disease, we're talking about mast cell stabilization, bringing the immune system back into balance, and also correction of gene expression, which is incredible because some conditions are rooted in genetic mutations. And if we can actually intervene and correct the function of those genes, this is a beautiful thing. We have the ability to address even certain conditions like cystic fibrosis with Amlexanox. So, who's a good candidate for this drug? Those with chronic inflammatory conditions, autoimmune conditions, again, MCAS, which is a big focus post-COVID, metabolic dysregulation, also chronic of treatment refractory skin conditions. And what that means, if you're not familiar with that term, is basically when you've tried everything. So you've tried this treatment, that treatment, the next treatment, and it's just not working. So we've seen Amlexanox work well for people that have eczema and psoriasis. I will explain why this happens, but what you want to be keeping top of mind are those T helper cells, which is a very specific type of immune cell. There are several different types of T helper cells in the body. But again, when they get out of balance is when we start getting dysregulation, and we specifically see topical skin issues when we have dysregulation of T helper cells. So also those who desire to lose weight. There are more and more clinics that I am seeing use Amlexanox as part of their weight loss protocol. And this is partially due to the inflammatory response that happens in visceral fat. Very interesting. We'll talk more about that. But again, keeping an eye on T helper cell dysfunction is really important. All right. So let's talk about Amlexanox and immune balance. I just love these little images and schematics. So you're not necessarily meant to be able to read all these words, but I do like the take-home point here. When we think about scales, we should really be thinking of any system in the body should be balanced at any one time. But we know that we experience sickness and dysfunction when we have imbalance. So again, Amlexanox helps T helper cells, specifically balancing out T helper 1 cells and T helper 2 cells. And when we see dysregulation of this, or these two types of T helper cells, a lot of times we will see those topical skin issues. So here, for example, symptoms of Th1 and Th2 dominance. So when we see too much overactivity of T helper 1 cells, that's when we start seeing food sensitivities, fatigue after meals, low thyroid syndrome. When we see Th2 dominance, that's when we start seeing skin allergies, postnasal drip, a lot of mucus production. I could put mast cell overactivation in this category as well. Eczema, GERD, histamine intolerance, which is a big one. So these are all really important to be sure we bring back into balance. Here's also some more information about what some of these cells do. But another one we want to pay attention to with Amlexanox is Th17. So here they kind of list it as troublemaker, but it's all bringing it back into balance. Sorry, I keep clicking forward. So we want to be sure all of these are regulated. We never want anything to be overreacting. When we have Th17 imbalance, then we start seeing some dysregulations in infections as well, and cancer would be one of those too. So I took this schematic or screenshot from a webinar I was actually listening to several months ago that was hosted by Pure Encapsulations, which is a supplement company. I have no affiliation to them. I just put it here, included their logo as a source to let you know where I got this image from. But I wanted to include it because I think it illustrates a really good point. This specific slide was talking about the immunological cascade of dysbiosis. So we were talking about gut health. We talk about dysbiosis, or basically dysregulation, or again, imbalance of the microbiome, or particularly the bacterial balance within the gut. What happens from that? So here we can see some information about inflammation in the GI tract, how that has an impact on the Th2 cells and the Th1 cells. So the point isn't to understand this graph, it's to understand how all these things are so intimately interconnected that it can be something just as simple as a bacterial infection, exposure to mold or fungus in your house, a virus. And that's kind of where COVID-19 comes in again. They call it a new instigation. So basically just something else that is kind of boom, hitting the immune system to knock it out of balance just enough that now the immune system is saying, okay, I really need to up my game here. I need to protect myself more. Now I'm going to start being a lot more sensitive and a lot more reactive to everything in my environment. So that could include foods, it could include medications, it could include supplements, it could include environmental pathogens. Nothing is excluded, especially when we talk about the mast cells, which is that immune cell that lives in every single system in the body, specifically the immune system. Now we've got the body perceiving essentially everything as a threat, which you can see how that is a really big problem. Okay, so there's been a lot of talk about GLP-1 drugs, tirzepatide, semaglutide. Everybody knows about these. So metabolic dysfunction and obesity, obviously we know it's been growing over the decades, but it's a hot topic right now. So what if we could use an alternate product that didn't have these nasty side effects, especially when they're overdosed, but instead think about what is the root cause of this obesity? What is happening at a cellular level that we can actually correct so that we can have a lasting, healthy, ideal body weight that is really geared more towards longevity rather than just looking good in our jeans, right? Like looking good in our clothes. So when we talk about Amlexanox and metabolic dysfunction, there's a great set of studies, and this is the second study here, kind of the second study after the proof of concept study. So when we put drugs through clinical trials, or we look back and we evaluate how people responded when they were prescribed this particular drug, we can get good information about, first, the safety, because we want to be sure that they're safe for human consumption. But then after that, most importantly, how do they actually work? How do they actually help us clinically? So this particular study looked at 42 obese patients that had both type 2 diabetes and non-alcoholic fatty liver disease. And we're starting to see a lot more non-alcoholic fatty liver disease crop up. So this study looked at how these particular kinases, IKK, epsilon, and TBK1, basically just fancy words for enzymes that exist in the body. However, we know there's an inflammatory link between obesity and type 2 diabetes. We know type 2 doesn't just happen overnight, but what happens in between, maybe having the genetic code for being predisposed to something like this versus actually having a hemoglobin A1C that's high or receiving that diagnosis of type 2 diabetes. We know that these inflammatory kinases that are being evaluated in this study are elevated in obesity. So what happens if we could control those or bring them down? We know that we get a reduction in weight, insulin resistance is addressed, and then also we can address fatty liver and inflammation that happens systemically in the body. So that's what we're trying to address with Amlexanox here. So this specifically was a double-blind, placebo-controlled study, which means that the people giving the medication, the people receiving the medication didn't know what they were giving or receiving. So this is basically the standard for really deciding if something is working or not. The people who were running this study found that there was a significant reduction in hemoglobin A1C, which is the marker on the blood test, or at least one of them that we use to evaluate type 2 diabetes. Now, the dosing isn't as important as it would be for your physician, who would need to know how much to write this prescription for. But just to give you an idea of dosing, this specific study looked at taking 50 milligrams of Amlexanox orally, so oral capsule, 3 times a day, and then followed up to be sure that it was safe, 25 milligrams 3 times a day. We're going to be talking about primarily taking 40 milligrams up to 3 times a day, to be somewhere in the middle of that. And that works really well for people, myself included. All right, so still on metabolic dysfunction. We know that there's a relationship again between obesity, type 2 diabetes. That link is inflammation, but obesity produces chronic low-grade inflammation in the liver and the fat. So wouldn't we want something that works in both the liver and the fat? We see a local release of cytokines and chemokines, basically messengers that have an effect in this case, a negative effect on insulin. So using something like Amlexanox can help to correct that by sending appropriate signals to the body to regulate insulin so that it behaves better. Okay, so we're going to dive into a few slides here about these great benefits and uses of Amlexanox. So first and foremost, I think one of its primary uses for us, as well as one of its most impressive performances in the human body, is that it stabilizes the mast cells. So it sends a signal to the cells, these immune cells, saying, hey, it's okay. You do not need to be overreacting so much. You're actually hurting yourself more than helping yourself by having this inappropriate immune response. So I've given several talks on mast cell overactivation itself. So it's definitely a conversation on its own. But again, to have a 30,000-foot view, you've got this mast cell, which is an immune type cell that is so intimate, so interactive, and has at least 300 different types of receptor sites on its surface, which means what? It's interacting with everything around it in its environment. So when anything binds to it, I'm talking medications, supplements, I'm talking hormones, a lot of different things that it reacts to in its environment. When it gets those receptor sites get bound up, then it starts going into action and it releases histamine, it releases leukotrienes and cytokines, and it becomes very interactive. So again, we really want to stabilize it so it's not causing us more harm, then good. Cancer is a hot topic. Amlexanox is being used in some patients with cancer because it helps to inhibit a different type of T helper cell called Th17, but not Th1. So we don't just want to inhibit everything. We want to be sure we're working on the correct cells. Longevity and inflammation. So it promotes something called cellular autophagy. Now, cellular autophagy is a routine process that happens in your cells 24/7. It's happening right now. What cellular autophagy is think about your cells are living organisms. They have metabolic waste too. So when you take your trash out from your kitchen or your house and you take it out to the curb, and then that lovely waste management gentleman or whatever company it is comes in the morning and picks up your trash, that's cellular autophagy. It's cleaning the trash out. Now, the more stagnant we get, the less we move, the more toxins we're exposed to, the more obtrusive of a diet we have, our cellular autophagy starts to power down. And then what happens is the body's smart. Its job is to keep us alive. So it's going to kill off the cells that are toxic or weak, and it's going to keep the ones around that are healthy and strong. So we want to promote cellular autophagy because cellular autophagy is the key to longevity, or to this space of anti-aging, if you will, or let's just say slowing of aging, graceful aging, healthy aging. So we want to be sure that we're keeping the good cells around, but that we have more good, healthy cells. It helps to balance the immune system, and it does this by, again, balancing the T helper cells and also to bringing macrophages into balance, which helps to kind of engulf some of these toxic cells. Neurodegeneration, so it helps to decrease inflammation and oxidative stress, particularly in the central nervous system. So those mast cells are highly present in the brain, the spinal cord, and in your nerves all throughout your body. So we want to decrease inflammation in those so we don't perpetuate early aging of the nervous system. Erectile dysfunction. Now, based on the mechanism of action of how Amlexanox works, just like some other medications that are available on the market that are specifically used for erectile dysfunction, it promotes maintenance of an erection due to the inhibition of an enzyme called PDE5, so phosphodiesterase 5. So basically, just based on the mechanism of action, it helps to allow men to get and maintain an erection longer. We're talking about nitric oxide breakdown. All of those things come into that conversation when we're talking about blood flow. And then it works as an antifibrotic. So again, we're hearing a lot more about non-alcoholic fatty liver disease and fibrosis in the liver and other tissues. So we want to be sure that we are not getting a buildup of fibrosis in the body. Now, metabolic disease, obesity, and diabetes. This one is basically worth reading word for word. So Amlexanox stimulates the breakdown of fat, reduces insulin resistance, stimulates the mitochondria, which is what allows the cells to make energy and oxygen for the whole body, lowers cholesterol. Now, if obesity is caused by inflammation, remember, inflammation is the link between obesity and type 2 diabetes. Then visceral fat, which is that fat that surrounds the organs, that's the super unhealthy type of fat, that tissue may become resistant to breaking down. So guess what? That's the body telling the fat, hey, you need to hang on and be strong and try not to allow anything to break you down so you can, beat off these organs basically for energy. Not good. This leads to obesity, insulin resistance, and what did we talk about at the beginning? Metabolic syndrome. So Amlexanox helps to lower Th17 inflammation, and it sensitizes the fat cells to break down. So that way we can get fatty acid breakdown and then reduction of fat. Very, very interesting mechanism of action here when it comes to weight loss. Amlexanox also helps to reduce blood pressure because it improves circulation and actually opens up the vessels. Non-alcoholic fatty liver disease we talked about, and then psoriasis. So it reduces inflammation and balances out those T helper cells again. Now we talked a bit about genetics. It can correct gene expression in cystic fibrosis, where the primary issue with cystic fibrosis is that at the genetic level, there is a misfunctioning chloride channel present in this disease. So a lot of the side effects, or I should say symptoms, that those people with cystic fibrosis experience are related to this dysfunctioning channel. And so there has been some pretty compelling information come out about Amlexanox being used in cystic fibrosis to help restore appropriate genetic function. Now, aside from mast cell activation syndrome, I think coming in second place, if not tied for second place of use for Amlexanox, will be for the use of allergies, asthma, and bronchodilation, which is opening up the airways in the lungs to get better air delivery to the lung tissue. So again, phosphodiesterase, that same enzyme that we talked about for helping men maintain an erection, it inhibits that in something called CAMP, leading to widening of the bronchioles to help with air delivery in the lungs, reducing inflammation, decreases the allergic response by inhibiting histamine. So if we think about if you are exposed to too much pollen that makes you feel bad, or you get a bee sting, which makes you feel bad, the area gets red because it's bringing a lot of good things to the site that has been, let's say, stung by the bee. And one of those things is histamine. Histamine's great. It's good for healing. But what's not great is when we don't know how to turn it off, which is why that's when we start using things like Benadryl or antihistamines. And many people will become reliant on antihistamines, not just after getting stung by a bee, but after eating certain foods or relying on them to sleep. Now, this is all tied together with mast cell overactivation, immune system dysregulation, and what we call histamine intolerance. So it's likely that you have some sort of histamine intolerance if you have become reliant on antihistamine medications. Also long haul. So long haul COVID, long haul syndrome, long haul COVID syndrome. A lot of this overlaps with mast cell overactivation. And so Amlexanox can help to reduce the brain fog, improve oxygen delivery to the lungs, and reduce histamine release, as well as inflammation that is associated with that. Okay. So whenever I speak to providers, or when I speak pharmacist to pharmacist, a lot of times we will use this term clinical pearls. Basically, what's our take-home point? Last week, I delivered a talk to physicians about this same topic. And so I've actually left this in this particular slideshow because I just think it's great. So Dr. Yusuf Salibi, who is a colleague of mine, a physician out of the Carolinas, has his own practice there and does just fantastic holistic medicine practice. Way ahead of the curve. He's always bringing new ideas to us. And actually, he was the one that had asked us at Physicians Preference Pharmacy to start compounding Amlexanox. So when I asked him, hey, what do you use this for? What type of people are responding to it? He says, I use it from anything like people that have MCAS, so mast cell activation syndrome, to issues with histamine, inflammation. Chronic inflammation, chronic inflammatory response syndrome, chronic Lyme. He treats a lot of Lyme disease. Also the vaccine injured, and those that are reliant on H1 and H2 blockers, so antihistamines. Those who are reliant on high-dose steroids, those with ulcerative colitis, Crohn's disease. So you can see there's a lot of inflammatory uses here. He usually is using 40 milligrams a day, and I can echo that. So I personally take Amlexanox. I do take one 40 milligram capsule once a day, unless I'm having active flares or we have a storm that comes through, brings a lot of pollen, starts causing a lot of allergies, then I will bump it up to 3 times daily. So I want to let you know what we have available on our formulary here, but I tell prescribers the same thing. I wouldn't really mess around with the lower or the higher doses. Use the 40, it's what's the most effective for people, and then allow them some freedom with dosing so that they can know, well, I'm in an active flare right now. Maybe I need to dose this twice a day or 3 times a day. We have a very mild side effect profile with what I would describe as queasiness. Now it goes through the stomach. It's going to open up in the stomach, that capsule. So just like anything taken orally, it can cause some discomfort in the stomach, but I definitely would describe it as mild. I am a big proponent of fasting, especially intermittent fasting or longer. So I generally don't eat until early afternoon. I do take my first dose of Amlexanox in the morning, and all I've had is some cream in my coffee. So there's not much. I don't need to eat a full meal to help soothe the stomach, and I don't feel it at all. So it's very easy to circumvent that side effect, and I would consider it to be very mild. Again, it's important to know what is working clinically. So as far as feedback the prescribers have given me, they say that it really helps with food allergies. Patients that are seeing a lot of food allergies in their providers that are seeing a lot of food allergies in their patients, autoimmune conditions, they're reporting lesser food sensitivity and reactions and less inflammation. Also, this one is just incredible to me. In patients with type 1 diabetes, so this is patients that do not make sufficient amounts or no insulin to help them absorb the nutrients from their foods, these people are the ones that are reliant on insulin. So this physician said, I have a type 1 diabetes patient who's been on insulin for decades, obviously. With the addition of Amlexanox 40 milligrams just once daily, along with sirolimus, also known as rapamycin, taken once weekly, he was able to bring her hemoglobin A1C or A1C down and blood sugar back into range. She says she feels great. She's lost weight and no longer is dependent on her insulin. So cool. Now, long COVID, a lot of good applications here, primarily helps with brain fog. As far as what our guests are saying, bronchospasms. So some of that reverberation or kind of vibrating of the lungs or the lung tissue improves greatly with Amlexanox. And we've had a lot of people be able to come off of their inhalers. And I love this because it stabilizes the lung tissue. Now, I have a very severe MCAS patient who we've been working very closely with, and I have over the last year or so. And she added in the Amlexanox 40 milligrams daily with good results to start. After the first 2 days, she was still having to use her inhaler as well as her nebulizer. And then the third day, only using her inhaler. So there's something we talk about in pharmacy called polypharmacy. Polypharmacy is when someone is using a lot of different drugs, a lot of different supplements, and probably a lot of different lifestyle changes too, to achieve their goals. Now, this lady here, when she first came to me, her med list was over 81 different products long. And the beautiful thing about this is that working closely together with her, adding Amlexanox, she's only down to 18 different products. And that might sound like a lot, but that's supplements, prescriptions combined. So 81 to 80, 81, excuse me, 81 to 18, I'll take that any day. All right. So here's some resources for you. On our website at physicianspreferencerx.com, each quarter I do write a newsletter, one for guests, one for providers. So this here is just a sample of the guest newsletter. You can go onto our website and read it there. And then also that young lady I was just talking about, that we brought her down to 18 different products for her regimen. I have a publication that I actually am co-publishing with Dr. Salibi, who I previously referenced, with a set of case studies, which I'm so excited for this to go public because there's so many people that need to hear this. We're talking about being able to bring people off of steroids and not be dependent on their antihistamines. And specifically, we are reporting case studies of people with mast cell activation syndrome, allergies, asthma, autoimmunity. And so this was a collection of case reports that will be coming out hopefully early next year. And that is everything that I have for Amlexanox. So I want to thank you so much again for bearing with me this evening with the change in schedule. For your attention, you can reach me here at my email or call the pharmacy directly. Prescription is still required to get Amlexanox filled, so you can call the pharmacy or you can go ahead and give your physician a call to get that started. And certainly if you're interested in being our guest at the Hotze Health and Wellness Center, or you know someone that is, you can scan this QR code or you can give us a call at this phone number. Our consultations are complimentary, so we would love to have you as one of our guests, love to help you with some of these symptoms that we have discussed or conditions that we have discussed, and we are happy to be here, and we would consider it a privilege to serve you. Here are my references, and I'm going to stop sharing now, and I'm happy to take any questions that we may have. So we have one here. Is Amlexanox a derivative of the gooseberry of India? So this is a question I do not know the answer to. That I have not heard before. I'm going to have to look into that. I do not have any knowledge about it being a derivative of that. So I would be interested to see, I guess, that information, if you have it readily available, as far as where you got that information, to read through it further. That's a great question. And we have another one. So if thyroid, Hashimoto's, autoimmune disease, and within 6 months now have psoriasis in the scalp, shampoo solutions, lotions, and GERD. So I think she's making just a reference of a lot of things that sounds like probably she's experiencing. Another thing to remember, and I know this is really hard, especially when you're the one in the situation, nothing like this happens overnight. When we talk about mast cell activation syndrome and a lot of these conditions that Amlexanox can be helpful for, they're all tied together. So please take courage in knowing that if we can get down to the bottom of the root cause of one of these systems, or even one of these symptoms, then we really can understand where we need to start to intervene with this immune system tailspin that happens, because you will forever be in that tailspin until you find the place to interject. And what I mean by that is, do we have to support the mast cells first? Do we have to balance the hormones first? What do we do? How do we get back to giving the body a little bit of traction to start healing and send those positive healing feedback messages to the body and to the brain so that it takes traction, remains strong, and builds a good immune system? So yes, all these things will continue to ensue and seem like they're building one on top of the other on top of the other until we appropriately address this. One of the great things about Amlexanox is that it has such a wide range of applications that can be so helpful. So will this help if I get chronic shingles? That's an interesting thought. So I have not ever heard it used for shingles. The reason that I would say yes, and if I was in this situation, I would also take it myself for this, is because shingles obviously pops up because the immune system weakens, and then a pre-existing infection arises or raises its ugly head, right? So if we can prevent the immune system being down, then we are going to be protecting against some of these dormant infections or conditions like chronic shingles. So yeah, I think that that's actually a fantastic use for Amlexanox. Great question. Yes, we have a question here. Can you give us the phone number again? I'm going to go ahead and type that out. Our phone number is 281-828-9088. And you will be getting also a copy of these slides and of the recording too. So you'll have my email there. I just want you to know that if you're not currently a guest with us, and you have questions about your, situation specifically, or someone in your family, something like that, feel free to reach out, call us, or write me a note. And we'll get you taken care of, because the last thing I want is for people to feel discouraged. And I see that every day. And I don't like that. I don't want that for anybody. I've been there in the medical system and feel kind of like a pinball just being bounced around. And I don't want that for anybody. Here, comment, I get chronic canker sores. So I see a holistic PA. That's great. I know I've had almost every test imaginable. No one can find the cause. I only have the one issue of Hashimoto's. Okay, so so Amlexanox used to be used for those aphthous ulcers, or also what we would kind of refer to as canker sores too, inside the mouth. So for one, Amlexanox orally can be helpful. We actually just this week started formulating a paste that was like the previous Apthosol, which is the paste that goes inside the mouth. So this might be helpful to actually address those canker sores itself. But, trying something like Amlexanox could be helpful for you, because if you do find benefit or do find resolution of your symptoms with Amlexanox, it can actually point to what some of the issues might be. Because if we give a medication or a supplement that we know has a certain action, and then we get improvement of those symptoms, it's going to be really good information to us to know what the root cause is that's going on. Good question. If you got further questions about that for that individual that posted that question, please, again, feel free to let me know. The great thing about these medications that are repurposed, including Amlexanox, is the price does not have to break the bank. I had jotted down the pricing here. If you're getting 30 capsules, anywhere up to 90 capsules, you're looking at a range of about $59 to $129. So we're not breaking the bank. And again, you have some liberty of when and how you dose it as you work with your prescriber. So we are all finished up here. Unless you guys have further questions, I want to thank you for the questions that you did bring, and for anything else that comes up, please let me know. Give me a call, write me a note, and I will be happy to chat with you about it. But I wish you a very Merry Christmas. If you're watching this live, I wish you a blessed New Year, all the best in health. So if you have questions, please feel free to reach out, and we'll talk to you soon. Take care. Bye-bye.